COVID-19 is still here, and we're actually seeing an uptick in cases here this summer.
It's a concern. The new numbers from Houston Health Department show the positivity rate is 12%. That's up from 10% just a week ago. And the wastewater load is 135%.
Joining us live this afternoon is Dr. Peter Hotez with the Baylor College of Medicine. Thank you, Dr. Hotez, for joining us. Let's jump right in here. So we are seeing that there's an increase in cases, but what about hospitalizations specifically?
Yeah, I mean, about 2 or 3 weeks ago, we were looking about the best we ever have been in several months, and so that was really good news. And the numbers are still generally good, but they are going up. As pointed out, the Houston wastewater now has been rising pretty steadily every week from 50% to 70%, 90%, now 135%. So it's that trend. Cases up, and nationally, hospital admissions over the last week are up 10%. So not huge jumps. But there is a concerning trend. So we still have to be cautious and recognize there's still a heck of a lot of COVID out there.
Well, Dr. Hotez, everyone is being encouraged to get a booster shot, of course. Many people that we speak with say that they're done. They've had enough shots. So what advice would you have for someone who maybe did get their last booster shot in 2022?
Yeah, now this becomes a little complicated because if you're over the age of 65 or immunocompromised, you are eligible for a second bivalent booster. I took it a few months ago. The issue is now there's likely to be a fall XBB booster for the currently circulating variants available sometime in the fall. The problem is I can't tell you when, whether fall means September, October, November. So the conservative thing to do would be to still get that bivalent booster if you're eligible, and then get a fall booster as we head into the fall, because as I said, cases are going up, especially now in the summer. People are traveling a lot. I'm getting a lot of emails or calls. Hey, doc, I'm going to Europe. What do you recommend? Or I'm going to travel different parts of the country or to South America. And you really do want to be boosted as best you can, especially to fight off this new XBB variant.
So we do have to ask you about a tweet that you posted a couple of days ago suggesting that we might see a bump in cases because of all the people going to see the movie Barbie and Oppenheimer in theaters.
Yeah, I didn't want to be too negative, and I tried to be a bit whimsical by saying if you think about wearing a mask in theaters, and if you do, maybe you can get a pink one, and I still think that's important because there is a lot of transmission, so that if you're under vaccinated or if you have risk factors, particularly, you probably want to wear a mask inside a really crowded indoor theater with transmission as it is and potentially going up, and so I think that's the conservative thing to do when you're in any indoor crowded area. For instance, I've been doing a fair bit of travel this summer, so on planes I'm still wearing either an N95 or a KN95 mask when I'm in airports. I took the Acela train from New York to Washington. In the train and in the train station I wore a mask. So be mindful if you're in a big crowded situation about masking, and particularly if you have risk factors, and keeping up to date on the boosters, and that was the reminder for the tweet.
Yeah, well, you certainly have a large audience on Twitter, so a lot of people chime in over there. Dr. Hotez, thanks so much for coming on Fox 26 News at 5. We appreciate your input.
Thank you so much.